Have you ever observed an elderly loved one persistently scratching their skin and questioned whether it's merely dry skin or a harmless habit? Perhaps you've brushed it off as something trivial, only to realize that the itching persists or even intensifies. But what if that ongoing discomfort is trying to convey something much more significant about their health than you might anticipate? It's simple to overlook, yet the reality is that chronic itching in older adults can often act as an important warning sign, indicating underlying health concerns that may need urgent attention. Seeking medical attention for chronic itching, especially in older adults, is crucial as it can indicate a serious underlying condition. If neglected, this issue may result in significant complications later on. In this video, we will explore 5 key areas of the body where ongoing itching could be a warning sign of a larger health concern. By recognizing these indicators, you will be better prepared to take swift action and prevent potential issues from worsening. Stay tuned with us. Stay with us until the end of this video, where we will not only emphasize these crucial areas but also delve into how early detection can significantly impact the provision of appropriate care at the right moment. We will examine the common signs to watch for when it's necessary to seek advice from a healthcare professional and how to address these symptoms before they escalate into more serious issues. This video is a must-see for anyone looking after elderly family members or friends, as being aware of what to look for could make a meaningful difference. Prevent long-term health issues and ensure that your loved ones receive the proper care when they need it most. By understanding these signals, you'll be empowered to make informed decisions about their health and well-being. Stay with us, because recognizing these signs can help you become a more attentive and proactive caregiver, offering peace of mind that you're catching potential health concerns early. With this knowledge, you'll be able to ensure your loved one's comfort, safety, and overall health. Don't miss out on these valuable insights. Here are some tips to get started. If you haven't subscribed to our channel yet, I highly recommend doing so and hitting the notification bell to ensure you never miss an update. Your support truly means a lot to me. If you found this video helpful, please help us continue spreading these vital lessons by liking and sharing them with your friends and family. Before we dive in, let us know your thoughts on this video. If you like the topic, please comment 1. If you think there's something I could improve on, feel free to comment 0. Inform me of ways to enhance the content I create for you moving forward. Now, let's delve into the indicators that may impact your loved one's health. First, consider the lower legs and feet. When it comes to the well-being of our elderly relatives, we must remain vigilant about even the slightest signs that something may be amiss. If you observe your loved one frequently scratching their lower legs or feet, this could indicate poor circulation. This issue, often neglected, is unfortunately quite prevalent among older adults and can sometimes. There are indications of more serious underlying health issues, such as heart problems or blocked blood vessels. Circulatory problems in the legs can significantly hinder blood flow to the lower extremities, leading to incessant itching, discomfort, dryness, and even painful sensations. It's crucial to monitor this closely, especially if your loved one is exhibiting other concerning signs, like unusual fatigue or expressing discomfort while walking. You may notice them taking frequent pauses during a leisurely stroll may arise, or they might express that their legs feel fatigued or achy after just a brief period. For older adults managing chronic conditions such as diabetes or hypertension, the threat of inadequate circulation becomes increasingly significant. In these situations, the necessity to stay alert and take initiative is heightened. It can be tempting to dismiss signs of poor circulation, but overlooking them could result in serious repercussions if not addressed. Complications like ulcers, infections, or even more critical issues may develop. Cardiovascular complications can emerge, significantly impacting the quality of life for those we hold dear. Picture witnessing a loved one silently grappling with their struggles, unaware of the extent of their suffering until it escalates. This is why it is essential to act promptly. If you observe not only itching but also alterations in skin color, noticeable swelling, or cramping, it is vital to seek medical advice immediately. Early detection and intervention can be pivotal in averting these complications. Encouraging your loved one to remain as active as possible is essential. Simple, gentle movements like walking or stretching can significantly enhance blood circulation, alleviate discomfort, and greatly improve their overall well-being. As caregivers, we bear the responsibility for not only their physical needs but also their emotional health. By being attentive and proactive, you can help your elderly loved one avoid unnecessary suffering and provide them with the support they need. As we navigate the journey of life, seeking comfort and longevity, we inevitably encounter the subtle transformations our bodies undergo with age. These changes often slip by unnoticed until they manifest in ways that demand our attention. One such change, particularly concerning our elderly loved ones, is the persistent itching at the back of the neck. While it may appear to be a mere annoyance, this ongoing discomfort could indicate a deeper issue, one that has the potential to impact overall health and well-being. As your loved one ages, subtle changes may occur that are not immediately noticeable. The spine and its surrounding structures gradually wear down, increasing vulnerability to various issues, particularly in the neck region where nerves are densely packed and highly sensitive. The neck plays a vital role in supporting the head, enabling movement, and containing a complex network of nerves that connect to the rest of the body. With the natural aging process, changes in the spine can lead to pressure on these delicate structures. Nerves under pressure can lead to discomfort, and at times, even painful symptoms. One of the initial indicators may be persistent itching at the back of the neck. While this itching might appear harmless, it could signal nerve compression or other spinal disorders stemming from conditions like arthritis, herniated discs, or degenerative spine issues. These conditions exert pressure on the nerves, resulting in sensations that can vary from mild itching to more intense symptoms, including tingling, numbness, or sharp, stabbing pain. It can be tempting to overlook a scratch or two, particularly when they appear on the back of the neck, an area that often escapes our notice. Yet, it's crucial to consider the broader context and take note of any other symptoms that might arise alongside this discomfort. Itching can easily be disregarded until it develops into a more serious issue. If someone close to you starts experiencing frequent headaches, struggles to turn their head completely, or reports tingling or numbness radiating down their arms, it's essential to pay attention. These indicators suggest that there may be a more serious underlying issue. Nerve pressure or spinal problems often extend beyond a single area, creating a ripple effect that can influence mobility, muscle control, and overall comfort. As caregivers, it's essential to take a proactive approach in recognizing these signs early to avert more severe complications that could impact your loved one's quality of life. If you're still engaged with this video and find these insights valuable, please comment 1 below to let me know you're still with me. The emotional weight of witnessing a loved one in distress can be profound. It often feels like a heavy burden to ensure their well-being, leaving us questioning whether we are doing enough. This is why it's essential to pay attention to symptoms, even those that appear trivial, such as itching at the back of the neck. Taking prompt action upon noticing these signs can significantly impact their health. Early intervention is vital in averting more serious issues, making a visit to the doctor a crucial step. The initial step in identifying the underlying cause of the symptoms, be it arthritis, a herniated disc, or another spinal issue, is obtaining an early diagnosis. This will enable you to investigate treatment options that can ease discomfort and enhance your loved one's quality of life. Once a spinal condition is identified, a range of treatment methods can assist in managing symptoms and potentially reversing some damage. Physical therapy can prove to be highly effective in relieving nerve pressure and enhancing spinal alignment, as it not only tackles the experiencing physical discomfort can be challenging, yet it is essential to focus on maintaining muscle strength, flexibility, and mobility. Medications like anti-inflammatory drugs may be prescribed to alleviate pain and reduce inflammation in the spine and nerves. These treatments can offer significant relief to your loved one, while also enhancing their emotional well-being by promoting overall health and a sense of independence. However, it's important to recognize that effective management goes beyond medical interventions. It also involves adopting lifestyle changes that foster spinal health and holistic well-being. Encouraging your loved one to maintain good posture can greatly alleviate strain on the neck and spine. Often, we overlook the impact of poor posture on the body, especially in the elderly, where muscle weakness and joint stiffness are prevalent. Simple habits, such as sitting up straight and avoiding slouching, can significantly prevent unnecessary pressure on the spine. Furthermore, integrating regular stretching and gentle exercises into their daily routine can enhance flexibility and relieve tension in the neck and upper back. These small everyday actions serve as practical solutions and a means of self-care that enhance both physical and emotional well-being. The stretching and gentle movements foster improved circulation, alleviate stiffness, and lower the risk of future injuries. As you embrace these changes, keep in mind that emotional support holds equal significance to physical treatment. Aging can often feel isolating and frustrating, particularly when facing chronic discomfort or limitations in movement. Compassion, patience, and understanding can truly transform experiences. Taking the time to listen to the concerns of loved ones, validating their feelings, and providing reassurance that they are not alone in their challenges can create a profound impact. Knowing that someone genuinely cares about their well-being brings comfort and peace, aiding them in coping with the emotional toll of aging. Ultimately, the aim is to enhance the quality of life for loved ones, physically, emotionally, and mentally, ensuring they feel heard, supported, and empowered. Implement modifications that can enhance their physical well-being. Often, it is the minor tweaks that yield the most significant effects on their overall wellness and joy. By remaining attentive to indicators such as itching at the back of the neck, proactively pursuing medical guidance, and cultivating a nurturing atmosphere of emotional support, you can assist your cherished one in gracefully managing the trials of aging, ensuring comfort and tranquility. Regarding the chest and upper torso, if your elderly loved one starts to notice ongoing itching in this area, the chest or upper torso may present a sign of something far more significant than a mere skin irritation. At first glance, it might appear to be a minor nuisance, easily overlooked. Yet, upon closer examination, this symptom could serve as an early warning of more serious issues, such as heart or lung problems. Detecting these subtle changes can be challenging, particularly in older adults, as our loved ones may feel too proud or too accustomed to discomfort to voice their concerns. However, as caretakers, we hold a crucial responsibility to remain exceptionally observant. Our aging parents, grandparents, and loved ones may not always express their health concerns directly, so we need to be attuned to even the slightest indications that something could be amiss. The skin on the chest and upper torso is particularly sensitive and can respond to various internal changes within the body, especially during fluctuations in blood flow. When heart and lung conditions arise, the body may attempt to signal distress in ways that are not immediately apparent. Itching may appear to be a mere annoyance or a trivial issue, yet it can signify something more significant that demands our prompt consideration. These symptoms are not merely indicative of slight skin dryness. They could suggest underlying problems with circulation, respiratory function, or overall cardiovascular health. Reflecting on when the itching becomes most pronounced, during exercise, physical activity, or stressful moments, can provide crucial insights. This can unveil a more troubling pattern during times of heightened physical activity, such as walking or exercising. In individuals with underlying cardiovascular conditions, the heart rate naturally elevates. This additional strain on the heart can worsen existing issues, making problems like poor circulation or respiratory distress more evident. The itching experienced during these activities isn't just a response to exertion. It may indicate that the heart or lungs are having difficulty meeting the body's demands. If the itching intensifies during moments of oxygen and blood flow, it may signal a deeper issue that requires attention. It's crucial to observe if the itching arises during periods of rest, especially at night when your loved one is lying down or attempting to sleep. This is typically when the body is most relaxed, making any problems with blood flow or breathing more apparent. Should your loved one experience a worsening of itching during these times, it could indicate their breathing may be compromised, particularly for older adults, as breathing problems often intensify when lying down. This change in body position can impact lung capacity and the heart's efficiency in circulating blood. Such signs may indicate that the body is struggling to meet the demands placed on its organs. Ignoring these signals could result in more serious complications later on, with conditions like congestive heart failure, chronic obstructive pulmonary disease, or arrhythmia potentially arising. Symptoms may present as itching discomfort or skin reactions in the chest and upper torso. Congestive heart failure, for instance, often shows up with swelling in the legs and abdomen, shortness of breath, and even skin reactions due to fluid accumulation in the body. Chronic obstructive pulmonary disease can lead to persistent coughing, difficulty breathing, and overall inadequate oxygenation, which might also cause skin discomfort or itching. Irregular heartbeats can interfere with normal blood flow, resulting in symptoms such as dizziness and palpitations, among others. Itching or discomfort in the chest area are not mere isolated symptoms, they serve as crucial warning signs that demand serious attention. It is vital to stay vigilant and observe for any accompanying symptoms that may arise alongside the itching. Be alert for indicators such as shortness of breath, which could imply inadequate oxygen supply to the lungs, or dizziness, suggesting insufficient blood flow to the brain. Additionally, any alterations in a loved one's capacity to carry out daily activities, such as getting around, should not be overlooked. Rising from a chair, moving about the house, or even engaging in everyday activities like cooking or bathing should not be dismissed. These seemingly minor shifts in capability can serve as crucial signs that the body may not be operating as it used to. If someone is finding it challenging to manage tasks that were once second nature, it's essential to take notice. When such symptoms arise, the urgency of obtaining medical advice cannot be emphasized enough. Consulting a healthcare professional promptly is vital to eliminate any serious concerns. Recognizing underlying conditions and prioritizing early intervention is crucial for preventing further health decline. Often, the earlier a condition is identified, the more manageable it becomes with prompt medical attention. Many of these issues can be effectively controlled, allowing your loved one to maintain a fulfilling life. It is essential not to overlook these subtle signs. As difficult as it may be, we must confront the possibility that our loved ones may require more assistance than we initially perceive. The truth is that aging brings its own set of challenges. There is a heightened risk for heart and lung issues, and tackling these concerns early can avert serious complications down the line. By remaining vigilant about symptoms such as persistent itching and other related signs, we can guarantee that our loved ones get the necessary care to uphold their health and well-being for as long as possible. While this may seem daunting, it's important to remember that even the smallest actions taken now could be crucial in safeguarding their health and happiness for the years ahead. Their well-being is of utmost importance to us. We must advocate with love, attention, and persistence, as it can truly transform lives. Let us not delay our actions until it becomes urgent. As our loved ones grow older, we often observe subtle changes in their bodies that reveal much about their health and well-being. One such change that might not be immediately acknowledged as a serious concern is persistent itching in the hands and wrists. If your elderly loved one is facing this discomfort, it signifies more than just a minor annoyance. It may signify more profound and serious concerns like arthritis or circulatory issues, which can severely impact one's quality of life. It's truly disheartening to consider that something as minor as a slight itch could herald larger, more daunting challenges in daily existence. Arthritis, whether manifesting as osteoarthritis or rheumatoid arthritis, frequently stands as a primary cause of itching in the hands and wrists. This isn't merely the skin responding to inflammation, it's the joints themselves that are involved. that are inflamed, stiff, and swollen, often causing a persistent discomfort that can be frustrating and demoralizing. Watching loved ones struggle to move their hands, something as simple as holding a cup of coffee can feel like a monumental task. The impact of arthritis on their joints can limit their mobility, making activities that once seemed trivial, like dressing, cooking, or even brushing their teeth, become monumental challenges. The emotional toll of this loss of independence is often invisible but profoundly felt. It doesn't end there. If the itching comes with other symptoms like pain, swelling, or a tingling sensation, these could be alarming indicators of nerve compression or joint damage that need urgent care. As the condition advances, it can rob your loved one of the freedom and joy they once experienced. You can't help but feel a sense of helplessness as they navigate each day, yearning for something, anything, that might bring them relief, even if just for a fleeting moment. Additionally, circulatory issues may also contribute to ongoing discomfort. Itching in the hands and wrists should not be dismissed, as inadequate blood flow can result in dryness and irritation, intensifying your loved one's discomfort. The implications extend beyond mere itching. This persistent discomfort may serve as a warning sign for more serious conditions like diabetes, hypertension, or peripheral artery disease, PAD. As the heart and vessels struggle to function effectively, it can be disheartening to witness how something as seemingly trivial as poor circulation can gradually undermine overall health and well-being of someone you care about deeply. If you are still watching this video and find these lessons useful, please comment below to let me know that you are still here with me. If your loved one is experiencing these symptoms, it's crucial to take action. Seeking advice from a healthcare provider can be a first step toward finding relief. Medications, physical therapy, and even lifestyle changes might be recommended to ease the pain, improve their mobility, and help them regain some independence. Encouraging gentle. Engaging in exercises, stretching, and maintaining an active lifestyle significantly contributes to joint flexibility and enhances circulation. However, the journey extends beyond mere physical care. Emotional support plays a crucial role as well. Being present for a loved one during challenging moments, whether through a listening ear or a comforting hand to hold, can profoundly impact their experience. Ultimately, it is the small, tender moments that provide solace and tranquility amidst discomfort and distress. As we age, our bodies naturally face changes, particularly in the lower back and hips. A multitude of changes occurs, many of which may appear subtle initially but eventually become more pronounced. One of the most concerning and often overlooked symptoms that can arise during these years is persistent itching, particularly in the lower back and hips. While itching may seem like a minor nuisance, it can signal that something more serious is happening beneath the surface. It's easy to dismiss these sensations as merely part of the aging process, but I believe it's essential to approach these signs with care and attentiveness. At times, the body's signals are conveying crucial messages. Persistent itching in certain areas may indicate underlying issues with kidney function. If ignored, this can escalate into more serious health complications, such as kidney disease or even failure. When the kidneys are compromised, they struggle to eliminate waste and toxins, causing these harmful substances to accumulate in the bloodstream. This buildup can trigger skin reactions, including itching, which may be confined to specific regions of the body. The lower back and hips, where the kidneys are located. While it may be tempting to brush off itching as merely dry skin or an allergic reaction, we must consider the broader context. If someone you care about is showing additional symptoms of kidney problems, such as leg swelling, persistent fatigue, or changes in urination, it is vital to seek medical assistance promptly. Early diagnosis of kidney issues leads to easier management and greater opportunities to safeguard the health of those we cherish. However, it's important to remember that it's not solely about. As we age, the spine undergoes changes that can lead to various issues, particularly affecting the nerves in the lower back. Conditions such as arthritis, herniated discs, and spinal stenosis become more prevalent, often resulting in increased pressure on these nerves. This pressure can manifest as pain, tingling, and that frustrating itching sensation. It's truly disheartening to consider the level of discomfort someone might endure, especially when it disrupts their daily life. Frustration can easily arise, often dismissed as a natural part of aging. However, it's crucial to recognize that persistent discomfort or itching, despite the use of topical treatments, may indicate an increasing pressure on the spinal nerves. No one should endure such pain without clarity on its origins. It's vital to discuss these symptoms with a healthcare provider promptly, as neglecting them could result in more serious complications in the future. The underlying issue may stem from kidney dysfunction or nerve compression. Early detection is crucial for managing the situation and avoiding further complications. It is essential to remain alert, heed the signals our bodies send, and seek the appropriate assistance before matters worsen. As discussed, ongoing itching in the lower back and hips might signify more than mere discomfort. It could indicate a need for attention, whether related to kidney function or spinal nerve compression. By being observant, we can address these concerns effectively. By recognizing these symptoms and addressing them early, we can avert more serious health complications down the line. So, what insights have you gained today that could alter your approach to your own health or that of someone you care about? I would love to hear from you. Please drop a comment below this video and share one thing you've learned today that you plan to incorporate into your life. Is it being more attuned to your body's signals, or perhaps understanding the significance of seeking medical advice promptly? Whatever it may be, we want to hear it. If you enjoyed this video, please share your thoughts below and remember to like, share, and subscribe to our YouTube channel for more valuable insights on health and well-being. Let's keep this journey going together, supporting one another as we strive for healthier, happier lives.